Hello everyone, I'm Dr. Adam Mohammed, a physical therapist with master's degree and a specialist in orthopedic rehabilitation. In our last video, we broke down upper cross syndrome, but today we can't ignore its partner in crime, whether you call it the little sibling or the bigger one, depending on how serious the dysfunction is. What is lower cross syndrome? It is a classic postural and muscular imbalance pattern, just like its cousin in the upper body. It's all about tight muscles fighting weak ones, and the spine plus pelvis getting caught in the middle. Here is the golden rule. For every tight muscle, for every tight and overactive muscle group, there is weaker one. There is weaker one and the underactive group being overshadowed. These poor, underappreciated muscles don't have anyone to speak for them. But don't worry, we've got their back. Okay, we will start by discussing the tight muscles in the lower cross syndrome. Tight muscles in lower cross syndrome are erector spinae and hip flexors. Meet the weak one, gluteal muscles and abdominal muscles. Hip flexors consist of three muscles, iliacus and psoas major and psoas minor. Here is the iliacus. Iliacus originated highlighted in red from the 2/3 of the iliac fossa, and the inner lip of the iliac crest, and here is the sacrum, the lateral aspect of the sacrum. Here is the insertion, lesser tuberosity highlighted in blue, psoas major. Here is the origin of psoas major from L1, L5 transverse process. L1, 2, 3, 4, 5. And the vertebral body of T12 up to L5. Insertion also at the lesser trochanter of the femur. Psoas major and minor and iliacus, collectively known as iliopsoas muscle. Okay, rectus femoris, this two joint muscle acting on hip and knee. Extensors for the knee, flexors for the hip. Rectus femoris has two head. Direct head, which means straight head, and reflected head, or indirect head. Reflected head. The direct head originates at the anterior aspect of the inferior iliac spine, and the indirect head originates from the acetabular ridge. Okay, it is inserted in patellar ligament. Insertion at patellar ligament, and the patellar ligament inserted at tibial tuberosity. Okay. Quadratus lumborum, part of back muscles, which is tight muscles. Okay, here is the quadratus lumborum. When we fix the hip, it side bend the trunk. When we fix the spine, it make hip hiking, like belly dancer. Okay, here is the back muscles. Back muscles, three layers. The first and superficial layers, trapezius and latissimus dorsi. What about the other two layers? Erector spinae, which make the spine erect, which makes the spine erect, longissimus, and spinalis, and the iliacostalis, and they have also 3 sections at cervical, at lumbar, at thoracic, but it is more detailed. And multifidus, so rectus spinae and multifidus and the quadratus lumborum, lumbar are lumbar extensors, which are tight, okay? What about weak muscles? Weak muscles like abdominal muscles, core muscles. So when we had lower cross syndrome, the first line of action or treatment to strengthen core muscles. Okay. So abdominal muscles consist of transversus abdominis, internal and external oblique, and rectus femoris, where is rectus abdominis. Here is rectus abdominis. Here is rectus abdominis, and inserted at the hip linea alba, inserted also at linea alba, okay, and inserted at the hip, okay. Gluteus maximus, huge and big extensors of the lower limb, and main also extensors of the lower limb. Its origin highlighted in red. Posterior gluteal line of the ilium. Posterior surface here of sacrum, and the posterior surface of the coccygeus, okay? And another origin of the gluteus maximus, which is thoracolumbar fascia, highlighted in green. Thoracolumbar fascia. And the last origin, the last origin of gluteus maximus muscle, which is sacrotuberous ligament. Highlighted in green. Okay. Inserted as common at gluteal tuberosity. Okay. Line in femur, marked in blue. Another insertion at iliotibial band. Okay. Let's break down this picture. When lumbar extensors are tight, and hip flexors also, and there is weak abdominal, there is weak hip extensors, it is the shape of our back. Compress the back of the disc. Nucleus bulbosus can be bulged anteriorly, okay, and there is stress on the posterior element or component of the vertebrae. Huge problem are the lower cross syndrome if not treated. Huge problems. Okay. Pro tips for clinicians: release before strengths. Don't activate gluteal until you have inhibited the hip flexors. Don't isolate, coordinate. Glutes don't fire well if the core is offline. Train anti-extensors. Focus on plank, dead bug, gluteal bridge with core engagement. Address lifestyle. Change your lifestyle. Prolonged sitting is often the root cause. Okay. Finally, final thought: lower cross syndrome isn't just about tight hips or back pain. It is a biomechanical rebel effect that disturb posture, movement efficiency, load transfer, and long-term joint health. So, don't just treat the pain, treat the pattern. Treat the pattern. Coming next, we will go deeper into the functional movement screen, best corrective exercise, and how to retrain neuromuscular control. Follow for more, and always remember, release the tight, awaken the weak, restore the chain. Okay? Finally, to address a condition like lower cross syndrome, after considering the necessary therapeutic exercise and the other physical modalities that we will discuss in more detail later, it's essential to consistently seek forgiveness and frequently repent to Allah. My message here is directed to non-Arabic speaking Muslims. And O my people, ask forgiveness for your Lord and then repent to Him. He will send rain from the sky upon you in showers and increase you in strength added to your strength, and don't turn away being criminals. ويا قوم استغفروا ربكم ثم توبوا إليه يرسل السماء عليكم مدرارا ويزدكم قوة إلى قوتكم ولا تتولوا مجرمين. صدق الله.